Material in this video contains content included in the RBT Test Content Outline, 3rd edition, TCO. E.2. Seek and prioritize clinical direction from a supervisor in a timely manner. Samantha is an RBT working with a 7-year-old client named Jordan. During a session, Samantha notices that Jordan, who usually engages well during session, is suddenly refusing tasks and becoming more frustrated. He tosses materials off the table and begins loudly repeating his words, which is a new behavior for him. Unsure if this behavior is related to a schedule change or something else, Samantha follows her training. She pauses the session and documents the behavior. Then, she contacts her supervising BCBA to seek clinical direction. Since the BCBA is unavailable, Samantha reaches out to the assistant clinical supervisor, just as outlined in her company's policy. Samantha explains the sudden behavior change and shares the data she's been collecting, which shows a sharp drop in engagement and an increase in maladaptive behavior that is interfering with the learning activities in Jordan's program. She also requests extra training on how to handle new repetitive behaviors happening during ABA sessions, as she has not yet been trained on the behavior intervention plan to decrease this behavior. By prioritizing clinical direction and reporting the data irregularities, Samantha helps the team update Jordan's behavior plan. Her actions show professionalism, protect her clients' well-being, and demonstrate how timely communication, training requests, and respecting the chain of command all support the highest quality of ABA care. Clinical direction is support and guidance given by your supervisor, usually a BCBA, to help you work correctly and safely with your client. It includes things like how to run programs, respond to challenging behavior, and collect data properly. You should never guess or make changes to a plan on your own without checking with your supervisor first. Asking for clinical direction shows professionalism and helps you grow in your role as an RBT. Getting clinical direction in a timely way protects your client and helps the therapy stay effective. If you delay asking for help, you might use the wrong strategy or miss important signs in the client's behavior. Your supervisor can help fix small problems before they turn into bigger ones. Following clinical direction also builds trust within the team and ensures that everyone is working together. When you follow clinical direction, your actions become more aligned with the client's treatment goals. Supervisors use their experience and training to make database decisions that guide your next steps. By applying their feedback, you help the client learn new skills faster and reduce challenging behaviors more effectively. Consistently using clinical direction leads to better progress, safer sessions, and higher quality care. Seeking and applying clinical direction helps you feel more prepared during your sessions. When you know you're using the correct strategies, you can focus on supporting your client with less stress or hesitation. Over time, these positive experiences help build your confidence and independence in your RBT role. Confidence leads to smoother sessions and a stronger connection between you and your client, as well as the entire ABA team.
Now that you understand what clinical direction is and why it's important, let's talk about when to seek it. Knowing the right time to reach out for support is just as important as knowing who to ask. Being able to recognize situations that require guidance helps you respond quickly, keep sessions safe, and stay on track with your client's goals. Let's explore the key moments when seeking clinical direction is necessary. Unfamiliar situations. When something happens that you haven't been trained on, like a new interfering behavior or skill acquisition program, it's important to ask for help right away. Guessing can lead to mistakes that affect the client's safety or progress. Supervisors are there to guide you through unfamiliar challenges. Always check with your supervisor to make sure you're responding the right way. Changes in client behavior. If a client starts showing new or dangerous maladaptive behaviors, report it as soon as possible. Quick communication helps your supervisor to immediately provide any necessary training, as well as review and update the behavior plan if needed. This ensures the client stays safe and gets the right support. Unclear procedures. Sometimes skill acquisition plans, prompting protocols, or reinforcement strategies may seem unclear or confusing. Rather than guessing, stop and ask your supervisor for clarification. This ensures that you're using the right approach during sessions. Following clear instructions keeps the client's learning consistent and effective. Signs of abuse or neglect. If you observe signs of possible abuse or neglect, such as bruises, fearful behavior, or unusual comments, report them right away. Even if you're unsure, it's your responsibility to speak up and follow reporting procedures. Protecting the client always comes first. Your quick action could connect them to the help and safety they need. Mistakes during a session. If you make a mistake like using the wrong prompting strategy or skipping reinforcement, let your supervisor know immediately. Being honest about errors helps the team correct the issue quickly and protect the integrity of the program. Mistakes happen. Addressing them openly shows professionalism and growth. Supervisors appreciate RBTs who take responsibility and ask for support to improve. Client or caregiver requests changes. If a client or caregiver asks you to change the intervention schedule, or how you run a skill acquisition plan or respond to a challenging behavior, you must check with your supervisor first. Even if the request seems small or helpful, only the BCBA can approve changes to the treatment plan. Following through without approval could lead to confusion, inconsistency, or harm. Always thank them for their input and let them know you'll share it with the supervisor for review.
Every organization has a chain of command to keep communication clear and organized. Knowing who to talk to and in what order helps ensure that concerns are handled efficiently and professionally. Let's explore what it means to follow the chain of command when seeking clinical direction. Every workplace has a supervision structure, often called a chain of command. It's important to know who your direct supervisor is. Usually, your direct supervisor is your assigned BCBA. You should also be familiar with who to contact if your supervisor is unavailable. This helps you get the support you need without delay or confusion. Each person in the supervision chain has a specific role and responsibility. Don't skip over someone unless there is an emergency that requires immediate attention. Going to the right person in the right order keeps communication clear and professional. It also shows respect for your team and the system in place. If you have a concern, the first person to contact is your assigned BCBA. If they are not available, you might reach out to a team lead or clinical manager, depending on your company's policy. Make sure you follow the steps your workplace has set up. Whether you're speaking with your BCBA, team lead, or another supervisor, always communicate respectfully and clearly. Use professional language and explain your concern with facts and observations. This helps your message be taken seriously and shows that you are a reliable team member. Professional communication builds trust and keeps everyone focused on helping the client. When you reach out to someone in your supervision chain, make a note of who you contacted, when you made contact, and why you reached out. This is especially important for serious concerns or repeated issues. Keeping records shows that you followed the proper steps and were proactive in seeking help. Documentation also helps your supervisors follow up and provide ongoing support.
Key takeaways for seeking clinical direction from a supervisor. Timely clinical direction. Always reach out to your supervisor right away when you're unsure how to handle a behavior, program, or procedure. Waiting too long can lead to mistakes or missed progress for your client. Recognize when to ask. Seek clinical direction when you encounter new challenging behaviors, unclear instructions, mistakes, or caregiver requests for changes. Knowing when to ask for help protects your client and supports high-quality care. Use the chain of command. Start by contacting your assigned BCBA. If they're unavailable, follow your company's policy to reach a team lead or clinical director. Respecting this order keeps communication organized and effective. Be clear and professional. Explain concerns with facts, not guesses. Use respectful, direct language so your supervisor can quickly understand the situation and help you take the right next steps. Document and follow up. Write down who you contacted, the date you made contact, and why you reached out. Keep track of any feedback or support you received, so you can follow through, show professionalism, and help your team stay informed. As an RBT, your dedication to seeking guidance, asking questions, and following the proper steps to gain training support makes a powerful difference in your clients' lives. Every time you reach out for support, report data concerns, or ask for more training, you're helping build a stronger, safer, and more effective therapy experience. By following the chain of command and prioritizing clinical direction, you show professionalism, compassion, and a deep commitment to the work you do. Your role is essential, and your efforts are deeply appreciated. Never forget that your actions help create meaningful change and brighter futures for those you support every day.